They've campaigned for 20 years to find out how their relatives died in the same hospital after being given drugs they didn't need. Now a painstaking report, 4 years in the making, says they've been failed consistently by hospital managers, by the police and by politicians.
The inexcusable failure of them all is not only shameful, it is scandalous and it is immoral. They have grossly failed their ethical standards by abusing people's human rights. Our vulnerable relatives who were stripped of their final words to their loved ones, silenced by overdoses, is more than catastrophic.
The report looked at events at this hospital in southern England between 1989 and 2000 and how relatives' complaints were brushed aside. The report says 456 people died here as a result of an institutionalised practice, shortening patients' lives by administering opioids like diamorphine without medical justification. And given missing records, a further 200 may have died for the same reason. A doctor called Jane Barton played a central role in prescribing the drugs. She was previously questioned by police but never charged. Relatives of those who died say there must now be prosecutions. The Health Secretary told Parliament on Wednesday that would be up to the police and the justice system.
But I can, at least on behalf of the government and the NHS, apologise for what happened and what they have been through. Had the establishment listened when junior NHS staff spoke out, had the establishment listened when ordinary families raised concerns instead of treating them as troublemakers, many of those deaths would not have happened.
Ken Woolley's father John was just 68 when he was sent to the hospital to recover after breaking his hip.
He wasn't in perfect health, but the bottom line is he wasn't going in there to die.
He never came out alive.
It was ghostly quiet because everybody, it seemed, must have been on the opiates. And it's not like a normal hospital, there's hustle and bustle. It was like you walk into somewhere that, and I'm going to use the wrong word, but the analogy is right, it was already a morgue.
The government said it will respond in detail later this year, but the relatives of those who died, many elderly themselves, want lessons to be learned and charges brought as soon as possible. Nadim, Al Jazeera, Portsmouth.